The U.S. is one of the two epicenters for the coronavirus, with approximately 4 million infected cases on a daily basis. Florida is of one major concern. 11,000 of the cases were reported just a few weeks ago on July 4th. Miami, Florida is normally packed. Florida has taken the threat very seriously. Its infection rate rose by 168% in June. The daily infection rate is above any infection rate of any European country. So is Texas, very high. Cases there have passed over 200,000. India is also having a problem. As of July 27th, more than 1.4 million people have been infected with coronavirus, and 32,700 have died in India. The concept of coexisting with the coronavirus is not a palatable situation for most Indians. In Africa, Johannesburg is felt to have the majority of cases, yet as of July 27th, more than 445,000 people have been infected with the coronavirus, and 6,700 have died in South Africa. In Hamilton, you can see that we once had empty gardens, and our public places such as the Waikato River were uninhabitable due to lockdown situations, in an effort to reduce our cases and protect our people. It's been over 6 months since COVID-19 has been declared a worldwide health emergency. In the last 6 weeks, the World Health Organization has announced recently that the number worldwide has almost doubled in just a 6-week period. There are over 640,000 fatalities that have been confirmed worldwide. Worldwide, the number of cases seems to be exponentially growing. It took 38 days to go from 5 to 10 million cases, and then more recently, in 24 days, it went from 10 to 15 million cases. And the last million cases took only 4 days to add another million cases. North America was the epicenter of the virus, saw a little bit of a drop, and now Latin America is turned into be the epicenter of new cases for the virus. The WHO has made some recent recommendations which fairly echoes what we have done in New Zealand. Isolate, find, test, and care for cases, and quarantine people that have been in contact. Keep the distance from others, clean your hands, avoid crowded and enclosed areas, and wear a mask whenever recommended. Where these measures are followed, cases go down, as shown in New Zealand. Where they're not, cases go up. Around a quarter of all the cases of COVID-19 are in the United States. Close to 150,000 people in the United States have died because of COVID-19, and it's felt by some researchers that a vaccine will not be our answer. Keeping social distances, guarding our borders, as shown in New Zealand, will probably be the best response as indicated by the WHO in other situations. Between 400 and 500 people in Florida, Mississippi, and Louisiana are confirmed to have the cases per million in those particular states, again indicating a worsening problem worldwide, especially those without strict measures. Unlike many other countries, New Zealand sets out an overall approach to have surveillance of COVID-19 as one of the core pillars of an overall strategy of disease elimination. National COVID-19 surveillance systems operate to to provide information about the characteristics of the disease in New Zealand and the effectiveness of the response. The plan sets out the current aims and objectives. Key surveillance activities and areas of ongoing development are critical. As we learn more about the nature of COVID-19 and understand more about our response capabilities, then aspects of surveillance will adapt in New Zealand in order to address these emerging problems, as especially indicated in our video today showing that Hamilton Gardens has reopened. The four objectives of testing in New Zealand are quickly identifying all cases of COVID-19 in order to isolate them, trace and quarantine their contacts, including as part of managing cluster outbreaks. A second part, ensuring that the access to testing is equitable for all people, for Maori, Pacific, and New Zealand Europeans, and for all priority groups, especially those that are of old age. Identifying undetected community spread in New Zealand is a critical factor always under investigation. Monitoring for any COVID-19 in people at high risk of exposure to help ensure the safety systems in place are working is critical, as can be demonstrated in the opening of our gardens. Under Level 1, people within New Zealand are able to travel and mix freely. However, it is more critical than ever that our borders are carefully controlled to keep COVID-19 out. People entering New Zealand must stay in managed isolations or quarantine for at least 14 days and complete a health assessment and return a negative COVID-19 test before they are allowed to go out in the community. In some situations, a COVID-19 test may not be considered appropriate and a health assessment will be completed instead. People from other countries can't enter New Zealand this time unless they have specific grounds for exemption, such as being essential workers or for medical reasons. These people will need to apply for immigration to New Zealand and for exceptions for these border closures. You can tell from this video that people from New Zealand and are living in New Zealand are moving about freely. We are not worried about COVID-19. The need for masks has been minimized or negligible, and we're enjoying our public places such as Hamilton Gardens and Hamilton Lake. We hope one day soon you'll be able to visit us, and we hope one day soon the rest of the world will start following an example of New Zealand. Previously, our overreaching principles have been to protect the wider New Zealand community from returning travelers and to isolate those travelers for a minimum of 14 days at the time of arrival. Core public principles that were engaged early on are central to the effort of preventing COVID-19. These principles included and will include, if necessary, ensuring good hygiene practices, which is a daily process for us, maintaining physical distancing when necessary if levels move up to higher points, and using PPEs correctly if indeed we need to engage this once again. Being alert and acting on any signs and symptoms of COVID-19 and identification of those that go to public places is critical and will prevent the spread and care of residents of those facilities.